Hello, everyone. Welcome to season 2 of Public Health in Real Life. This is a channel dedicated to educate people about public health issues, celebrate unsung heroes in this field worldwide, as well as to inspire the next generation of students and leaders within public health. In this program, we are celebrating the World Autism Day, and we have an exciting interview uh, to learn about autism and to understand some of the misconceptions that are spreaded all across the world. And this program hopefully will help us to debunk some of those misconceptions, as well as leave us with a well-informed understanding about autism, and also to mark the important day of World Autism Day. With that, by the way, my name is Ashwin Kadambi, and I hand it over to Dr. Maimuna Alex Adiomi, my co-host.
Thank you for the warm introduction, Ashwin, and thank you also for highlighting Autism Awareness Month. Our interviewees or our guests for today are Dr. Louisa Mudawarima as well as Desi Tomova. So just a brief overview on Dr. Louisa, who is a neurodevelopmental pediatrician. She's from Zimbabwe and she currently works at the Children's Rehabilitation Unit at Harare Central Hospital. She's also a lecturer at the University of Zimbabwe College of Health Sciences. She trained at Red Cross War Memorial Children's Hospital in Cape Town, South Africa. Louisa has interest in interdisciplinary management and community involvement in the care of children with disability and delineating the etiology of disability in Southern Africa, with the aim of reducing the incidence of overall disability in children in the region. She has also noted the impact of cultural beliefs in the care-seeking behavior of families in Zimbabwe, and I dare say in other parts of Africa as well. And she believes that more research is needed to explore cultural understanding of developmental disability and how to support families with affected children. You're welcome to our show today, Louisa.
Thank you very much, Maimuna and Ashwin.
And our second guest today is Desi Tomova. Desi's son, Johnny, was diagnosed with autism following surgery for brain tumor. She currently lives in Dubai with her family where she cares for her son. So to get to the business of the day, and I'll start with you first, Desi. Tell us about your journey to autism.
Well, hi to all of you. My journey, in fact, it's not, let's say, the typical. I don't know which one is, in fact, the typical journey to autism. But initially, everything was, how to say, like everything was looking okay with my son till he turned 1. And then he started losing acquired skills very quickly. And long story short, we end up in pediatric neurology, having an MRI done for him. At which time we understood that he had a very big tumor, pilocytic astrocytoma, and following in 8 months, he had 4 brain surgeries, after which already 100% of the tumor was removed. But a few months later, after the last operation, he started developing some sensory problems. He stopped responding to his name and things like that. So I had him, I took him just in Bulgaria because I am originally from Bulgaria, and at that time we are in Bulgaria. So I took him to professor of neurology, a pediatric psychiatrist, and some therapists to meet him. All of them, they were the same opinion that he has autistic symptoms. Because of his age at the time, he was at the time 2 years and 3-4 months old. They said that nobody of them can say exactly till which extent and how it's gonna be after some time. the doctors, they were all on the opinion that this is kind of secondary autism due to all the interventions which he's been through. So for me as a parent, in fact, the reason was not important. The important was what now? What are we gonna do after that to deal with the situation? This was, in fact, the first few months of COVID-19. So we are under lockdown. I couldn't do much about it at the time. Only in the yard, we're trying to make some games with my big daughter for him, some sandbox, some Play-Doh, paints and things like that. So I can say that for a few months, he improved for some sensory issues. But it was obvious for everybody that he has problems. After I took him into Turkey, because two of his operations were made in Turkey, I met another professor of neurology, another psychiatrist. They're exactly on the same opinion without to see the previous, that this is kind of secondary condition. And that's how we end up with the autism diagnosis.
Thank you for sharing your remarkable story, Desi. It definitely speaks of courage, of faith, and a lot of trials along those lines. So Dr. Louisa, according to the Center for Disease Control's report, 1 in 44 kids have autism in the United States. But then when you think about the global perspective, according to the World Health Organization, 1 in 100 children have autism or are on the autism spectrum disorder. It's also noted that the number of autism cases has been rising significantly over the past number of years. So from your perspective as a clinician, as a researcher, what would you say are the key factors that are influencing that increase in autism diagnosis? And what are also the factors that contribute to autism spectrum disorder?
Thank you, Maimuna. I think there is a substantial component of diagnoses being made now that were not being made previously because of human resource limitations. And by that, I mean people who were skilled in making the diagnosis of autism and other developmental problems that happen or occur in young children. So I think to a certain extent, or to a large extent, the numbers that we're starting to see now are because the services are starting to become available. There's also the perspective that previously, if a diagnosis was made, if you have a very resource limited setting, such as what you get in places like where I'm from, and other places in Africa, the capacity to rehabilitate a child who has a diagnosis was not necessarily available. And so there was also the question of the ethics of actually making a diagnosis when you had nothing to offer a particular child. The other thing is, there've been changes in the education system, with the education system becoming a lot more inclusive, with recognition of different learning patterns and different styles that children will have overall. And that accommodation, it has actually, led to there being a benefit in recognizing a particular diagnosis such as autism so that an educational program can be tailored to a particular child. In terms of what some of the causes from an etiologic perspective could be, we do know that genetics don't fully explain the full sort of incidence and pattern that we see with autism in terms of, even in twin studies, you can find that there are differences between identical twins, for example. And that suggests that there is a large environmental component in the development of the actual, spectrum picture. And so it is very possible that there are different environmental things that are happening, and the different environments can be, even within a body, so intracellular, and the overall environment. So, you know, we don't know what the impacts of some of the things that have been happening over the last 200 years. So, for example, the use of fossil fuels, environmental changes, and, you know, use of more chemicals and things like that. It's very difficult to say, and it's actually hard to pinpoint whether those could be having an impact. But, you know, it is very possible that there are things that are changing in our environments that are leading us to see more cases of autism as well.
Thank you for that, Dr. Louisa. Absolutely, the epigenetic factors have a huge role in autism. When it comes to you talked about the environments, and you are also a researcher in cultural backgrounds of people, and there are beliefs really have an impact on how quickly you know treatment is parents seek treatment for children in traditional hospital settings, as well as there are cultural backgrounds can also impact the treatment course. So what have you seen as the connection between cultural background and what are its impacts in seeking care and the actual care itself?
Thank you, Ashwin. One of the things that I teach when I teach my students is that often by the time a family comes to you with a child who has a developmental problem in our context, you're at the very end of a very long line. And often by that time, frustration is bubbling over. They are experiencing a lot of stress. They've gone through ostracism within their communities. And, you know, the picture that I try and paint is looking at an individual who is living in an urban setting, you know, in a context such as the context that I'm in. So what would happen is that firstly, they would notice that something is going on, and they wouldn't necessarily head straight to a health facility. What they're going to do is speak to the matriarchs and the patriarchs of the family. And the matriarchs and the patriarchs will have certain advice that they will give. And, you know, the mom and the dad will try and follow the advice that they receive from those individuals. Then once they've noted that maybe this is not working very well, the matriarchs and patriarchs will come together again and maybe advise another more traditional. So they might advise, you know, to go and see a lady who helps with healing in the area, or someone who's into herbal treatment or something like that. And then that might not succeed. And then they would advise someone else. So for example, a faith healer or a traditional healer. And these are all steps that an individual has been taking. And then after that, they may go to a traditional clinic setting.
Yeah.
And because it's difficult to pick up what is actually going on, they may be asked, let's keep an eye and let's come back after a month or two. And then after that wait, and this is anxiety that is building up, they may be referred and then referred again and then referred to a tertiary or quaternary center where they finally get a diagnosis. And, you know, it's a very long and difficult journey for anyone, you know, let alone some of our families that have resource constraints, that are having to take time out of their busy schedules, you know, where every single minute that they have to make ends meet, and they're having to take time out from that in order to seek healthcare for a child. The other thing that also happens in the context of autism, and, you know, I think this is similar to what Desi might have experienced, is you have a child who has been developing well, and then for one reason or another, they start to regress. And it can feel as if, you know, there is something that is interfering with your child. You know, those who believe in witchcraft and those sort of interferences may seek to find out what what those interferences are prior to presenting to a traditional healthcare setting such as ours. So all of these things do impact health-seeking behavior and can really delay the presentation of children, and actually hamper them coming within that window of early intervention.
Got it. And Daisy, actually, Dr. Luisa made a great connection from how, what are the different obstacles for patients or before they even reach the health setting. So from your experience, after you have reached to a traditional health setting, what are some challenges you faced with the healthcare system / the caretakers, and at the same time, the overall infrastructure and the system that was prevalent when you were seeking care?
Now, of course, keep in mind that most probably what it was in my case is not the same, but for sure it's similar in some places in the world. First of all, when I had already my doubts that my son is somewhere on the spectrum, then I just try to find, as I said, at that time I was in Bulgaria, my home country. I just try to find some traditional, absolutely traditional doctors, which are well known that they are dealing with such kind of kids. And because the waiting list, if you want to see them through the Bulgarian healthcare, it's very long. Maybe I had to wait something between 6 and 12 months to reach there. So through friends and of course paying cash, I succeed to make appointment for my son just in 1 month. So I think that for many parents, it's very big issue, exactly the financial part.
Yes.
Because yes, of course, you can wait 6, 7 or whatever months to have the diagnosis. And in fact, in many cases, I dare to say that diagnosis is not so important. It's important how to help the child,
Yes.
how to improve the child's condition and the family lifestyle, because this is something which affects all the members of a family. It's not just the child. So if parents, they have to wait months and months until they get diagnosis. And this is in countries which there is good system which after the diagnosis works in providing some therapy, some help, whatever the child needs, and the parents, of course. So he can, according to his situation, of course, to improve and to learn and to develop, because that's why it's called spectrum. We know very well, it's not a secret that in some cases, there will be big improvements. In some, unfortunately,
yes,
whatever you do, the improvement is not so significant. So yeah, this is one big challenge for me. Anyway, I reach there, I get from few different doctors the same opinion. So I had no doubts that this is the situation. I mean, if there were different opinions, yes, maybe. But as the opinions were more or less exactly the same, I already had no doubts. Now, the thing is that my son's situation is a little bit complicated because as he was born and the biggest part of his life, he lived here in Dubai, in Emirates. The few words which he was saying, they were in English. So even if I wanted to have him for therapy in Bulgaria, the professionals, they're on opinion that it's gonna work for him slower than otherwise, because it's something which he doesn't know. Here in Dubai, there is very little help for parents like me, close to nothing. If I want him to be on extensive therapy, this means I have to be able to pay for it.
Yeah.
which unfortunately I am not. But as we're sharing, what are the challenges in front of the parents?
Absolutely, yeah.
Yeah. Of course, this will not make me quit the idea for my son and to stop looking for ways to improve his situation. Just that's why my big son, I have son who is 22 years old. He made a fundraiser even for him, GoFundMe, and trying to help us in any way he can. I had many friends which they help us even at the time of Johnny's brain operations. I'm doing whatever I can at home. I have a therapist who works with Johnny online. She's doing it pro bono. And I can see that in some things he improves. Yes, he's not social very much, but he doesn't mind people. In fact, he's more interested in adults than in kids. He speaks, but he's using the language just for like a consultation. Like if he sees it's raining, he can say rain. But if you ask him a question, rarely he will respond. I think this is a common problem in many cases.
Yeah. Thank you for sharing your challenges, Desi. And we'll definitely still spend time talking about your campaign and just make sure that we can also get the word out there. So in terms of, Desi had mentioned treatment options, and it was interesting that she mentioned even just the language that Johnny was used to and how that language could also affect the quality of therapy that he could receive depending on where he received care. So Dr. Louisa, then, the past decades, there has been, evidence of, rapid advancement in deciphering the different molecular mechanisms of autism, as well as, advancements in developing several cutting edge, therapeutic strategies and treatment options. So from your experience as a physician and also a scientist, how do you think the impact of these technologies have, one, either decreased the incidence of autism or managed it, or improved the health of people on the spectrum?
Thank you. So I'm not really going to talk so much about the cutting edge technologies, because I think I am from a continent where a lot of these things, we haven't had a lot of penetrance from these things. But when we look at some of the things that we now almost take for granted on a day-to-day basis. So, I think this is one of the things that has, come to the fore in our lives. The ability to commune online the way that we are. So we're currently in a Zoom meeting in 4 different locations. The ability to actually work remotely from home so that we're not necessarily having to travel to go into a workspace. I think those things have had a real impact on the management of people who have autism. But at the same time, they have made things a little bit more complicated. So, for example, Desi mentioned that she accesses therapy remotely. And this is something that is really helpful, especially in this context where, we may have limited numbers of people who are skilled, who may be congregated in, maybe 1 or 2 main centers. It therefore means that you could potentially use a telehealth service in order to reach children who are in more rural and remote spaces. But at the same time, we have a large number of children where we are using gadgets excessively. And there's a little bit of a blurring of the line when it comes to seeing whether the communication difficulties that we're seeing are because of an intrinsic problem, such as autism, or if it's actually external because we are overexposing our young children. So that's, one perspective. And I know we're not really talking about, that molecular technology and some of the things on the cutting edge, yes, there've been great strides, for example, in genetics, where, you know, looking at the genetics is really, really helpful in making decisions about what the particular etiology of autism in an individual is, and also the likelihood of a couple having another child who is going to, you know, manifest the signs and symptoms of autism. However, that is not technology that has really become relevant in the context that I am in.
No, it's interesting you mentioned the context of what technology is readily accessible to a majority of the world, and then also how that technology can be put in effect. You had mentioned something initially when we talked about, like, you know, incidents of autism, and you said that, you know, some of the rising cases we might be seeing might just be because people are more trained in and able to diagnose autism. But then, you know, you are probably one of the very few neurodevelopmental pediatricians in Zimbabwe and probably on the continent. What strategies are you aware of, or would you recommend should be deployed by, like, the regulatory bodies, government, and other policymakers to address that gap in human resources for health?
I think we've been very fortunate because we've had especially in my country, we've had this concerted thrust by our government to make sure that rehabilitation services are available in every district in the country. So, you know, if you make a diagnosis of something that could be happening with a young child, you have a structure to refer them into. So although sometimes the diagnosis may be limited to major centers, you know that you can then, you know, send out a child and they have a district hospital that is relatively close to them that they can access care from. The other thing that has happened is actually, interestingly enough, research. You know, the way that I got exposed to the neurodevelopmental world was actually quite interesting. We had a professor called Prof. James Hakim, the late, and he applied for a grant in order to promote education amongst university graduates in medicine, in cardiac care, and mental health. And I applied for one of the mental health fellowships, and I went for a child psychiatry attachment. And when I was there, through linkages, I was exposed to the area of neurodevelopmental pediatrics and neurology, as well as the child psychiatry. I am not a psychiatrist, so this was actually out of interest. And because of that, I was actually able to be channeled appropriately so that I could receive the training that I have received. And there's several other people who have similar stories to what I have, you know, people who have subsequently trained in community psychiatry, women's health psychiatry, and that sort of thing. And in addition to the specific training that I got, what they also did was to have a series of workshops where they would bring in healthcare professionals and make them aware of some of these important issues in the pediatric and child mental health and child psychiatry space. So, you know, that has been very beneficial. In addition to that, we are now making a concerted effort through the University of Zimbabwe and other universities that are training medical students, and particularly ours who are training specialist pediatricians, to actually have enough exposure for our graduates to be able to make a basic diagnosis, so that we're not necessarily referring patients over long distance in order to have a diagnosis. So, you know, I may be the only neurodevelopmental pediatrician, but I know that in several of the centers, there are graduates who I have trained together with my colleagues, you know, who have had a bit of exposure in child psychiatry, who have had exposure in pediatric neurology and neurodevelopment, who have the skills to actually assess and make a diagnosis.
Thank you, Dr. Louisa. we are able to see that, the kind of challenges that different countries face are really unique to those countries. And it really begins with proper advocacy, proper engagement of policymakers, as well as a whole of a government approach. And the non-communicable diseases community, I'm tracking, they are making some progress, and each individual non-profit organizations are also making progress. But yeah, it really begins with advocacy and a whole of a community approach as well. Speaking of community, Desi, can you speak a little bit about your GoFundMe page and how the idea came about, and how the journey went with it, and how it is currently going? In addition to that, can you also discuss any challenges you faced? Or let me frame it this way. What is your advice to people in the community who know of parents who have autistic kids? How should the community engage with such parents and make sure they support them?
Okay, thank you for this question. Let's start from this question, and after we'll speak about the GoFundMe, because yes, for me, it's I'm not gonna lie, for me, of course, it's most important my own child and his progress, but the big picture is really the community.
Yeah.
So how to put that? I want the community to think of the future. We start this conversation with the numbers, which are very important numbers. The kids on the spectrum are on the rise. And this, we cannot hide ourselves from the numbers. Maths, it's a science. So these things not gonna change in a good way if we're not doing anything to change it. And the way for me to change it, the community has to understand that these kids, which they are kids today, doesn't matter on which part of the spectrum. They're gonna be adults in, let's say, 20 years. I think it's gonna be earlier, but let's say 20 years.
Yes.
And I want somehow the community to understand that there is another side of autism, not the romantic side of random movies and some famous people which I don't know, they were really diagnosed or they finding it good PR to put it in their bio that somewhere on the spectrum. Now, the parents which they have child on the spectrum, they living with the other, not romantic side, with the side where this child has tantrums maybe 50 times a day, hysterical, they cannot go out of home. There are kids which they refuse, for example, to get into car. I'm not speaking about drawing blood or cutting hair or something like that. I'm speaking just taking this child out for a walk.
Yeah.
Now, I'm not going to lie, I'm taking my son out, but he's in a stroller because I cannot, he's already too strong and I cannot take the risk that he'll run in some direction and maybe I won't be able to stop him. And this is, of course, in the city, you know, how are the things? You cannot be sure that you can keep him safe. Also, of course, as a parent, which I know that my son, sometimes he has some outbursts which are not very safe for the other kids around, also makes me put him restrained in the stroller to be sure that everything is going to be smooth. So yes, in general, I want the community to think about this side of autism. Right. Because the other one, the romantic, it's okay. And everybody, I think all the parents of autistic kids, more or less, they'll agree with me that they'll be completely happy if their child one day grow up just with some strange part of his behavior, which makes him a little bit nerd, but doesn't make him out of the society. But these are not so many cases. Most of the cases which they cannot access the right therapy, the right because all of us will know that it's not only the autism. Usually these kids, they have compromised immune system. So there are many other things going together with the autism, which we have to treat.
Yeah.
For example, my son last, let's say 8 months, he developed some rashes, a kind of asthma, things which never before he had.
Yeah.
And for the GoFundMe, the idea came from my big son, my first child, because when we still had the brain operations of Johnny, we had some help from friends, and they make something similar, but they made it in Bulgaria.
Okay.
To help us, because again, all the operations were not covered by insurance, only the first one, and we get a loan. The money again, they were not enough, so we get friends help and something like some fundraiser in Bulgaria. So my son, who's currently works in Germany, he said, let's make a GoFundMe, and let's try just to spread the word in between our friends and colleagues and whoever decide to help us, because otherwise we're going to lose time.
Yes.
One way or another, I believe that we're going to find a way to help Johnny, but it's much easier if you start doing this when the child is small. I mean, all the parents with which I spoke, which they've been already down this road, this which had bigger success are which they start early.
Yeah.
Of course, you cannot make exact forecast where you're going to reach at the end of the journey.
Right.
But as the earlier you start, are better the chances to reach in a good place.
Sure.
Yeah. Thank you so much for your very, very passionate plea and story, Desi. As somebody who has encountered people with autism and probably also not necessarily understood what it was, because to a point you made earlier, Louisa, that the developmental milestones might be hit and everything is normal, and then it regresses, and then people begin to think, what could it be? Could it be something for people who think of diabolical forces and all of that? We've had those kinds of conversations at the community level. And for you, Desi, to just share your story about the fact that it's a spectrum and there are so many sides to it. Basic tasks like just getting your child out the door can be an entire production. Again, it's just really, really hard. I wouldn't say heartwarming, but it just really touches my core to hear you say that and say that passionately as well. So thank you for advocating for that. Louisa, along those lines, something Desi had touched on is it's going to be a holistic approach to managing, not just kids, but the families on the spectrum. So what are resources that you would recommend for people? And I also want to highlight that you had mentioned it, and Desi further, confirmed it, that treatment has to start early and that there's just that narrow window to get a diagnosis and start, the intervention. So along those lines, what are resources you would recommend to anyone who is having to deal with anybody, a loved one, a child, or a patient on the spectrum?
I think one of the most important things, which is something that Desi has touched on, is find a community. Find other people who have gone through the sort of thing that you are going through, or not necessarily identical, but similar, and learn from those people. Even if they haven't gone through that particular experience, they are more likely to be supportive of you as an individual, because they can better identify with the things that your child is going through than other parents. So one of the things that we do is we encourage parents to start parent groups on social media. So, for example, platforms like WhatsApp have several parent groups with different conditions, and parents are always welcome to join. There have been several point persons, and as we've gone along, I've actually discovered lots of other people who are doing lots of work on platforms similar to that. I think there are platforms on Facebook. I'm not really on some of the other social media platforms, but I think that there are services available there as well. So, you know, finding that community, however remote, but try and link up with other individuals. And then the services that will be available to you will depend on the context that you're in. So in different countries, they may have training programs for different types of professionals. But having a multidisciplinary approach, so having input from therapists from several different disciplines is often very beneficial. It's beneficial in confirming your diagnosis, but not only in confirming your diagnosis, but also, you know, actually seeing particular nuances that your particular child or patient or individual that you're looking at is facing, so that they can be better managed. And also coming together as a team is helpful in tailoring the best plan for your patient as well. In our context, we have, you know, we are fortunate that we have a lot of physiotherapists, also known as physical therapists, and, you know, in the US, we have occupational therapists. We have limited availability of speech and language therapy. And that is one of the things that we really feel on a day-to-day basis, because it is a service that is sorely needed. We have clinical psychologists who stand in that counseling, psychology, psychotherapy, and assessments gap as well, who also not only support the young child, but support the older members of the families. And we are fortunate to have a social work service as well. It's not available everywhere, but, you know, having a multidisciplinary approach like that is very, very helpful.
Well, thank you so much.
Quite comprehensive.
Yes, I agree. Really enlightening. So we've actually come to the end of our interview. We would like to thank you both for your time, Desi, for sharing your story. For anyone who is willing and interested in supporting the GoFundMe for Johnny, please just check on Facebook. It's Desi Tomova, DESSIE TOMOWA, Tomowa, right? Correct, Desi?
VA.
Yes, and we would also be sharing it on our LinkedIn page as well as our Facebook and Instagram pages as well. Louisa, thank you for just showcasing your work. I know you are involved in a lot of research. I happen to also just overlap with you professionally with work you're doing with like the Cerebral Palsy Alliance. So, you know, we really appreciate all of your time. As we close out and round up, you know, Autism Awareness Month, one of the things that struck me as a slogan with autism was, you know, for a lot of people on the spectrum, or what we call neurodivergent people, they are just different, not less. So that caption really struck with me: different, not less. So once again, we thank you for your time. We you know, keep doing the great work you do, and we hope to see you again. Over to you, Ashwin.
Yes, thank you so much, both of you. We were able to learn a lot during this interview, that the challenges that different countries face is unique to that particular country. And when you look at the biochemical part also, there's a biochemical genetic part and there's an epigenetic part. Then you have low income, middle income countries facing a different kind of issues, high income countries facing a different kind of an issue, where systems might be a bit more advanced. So there's just a lot of variables that go into you know, looking into autism and getting to towards you know, lessening of the cases of autism worldwide. So thank you so much for all those good information provided. And Desi, thank you so much for sharing your story today. We hope that through your story, people have a better idea about how to look at families as well as at children facing a spectrum of autism. And so thank you so much for this interview, both of you. Over to you, Meena.
Yes. So once again, thank you both so much for your time. We hope to see you again, and good luck with next steps. Bye.
Bye.
Bye.